and thank you, Mayor Coleman, for that introduction. And I want to thank Organizing for America for asking me to come here today and share my story, and for the SEIU, my union, Service Employees International Union, one of the largest unions. Every day we fight for health care for all Americans, and this is a fight we will not give up. Mayor Coleman asked me just a second ago if I was going to share a story. I told him, I said I have 4 stories to share, so I will be brief. But these stories are not unlike any stories that you or your relative or your neighbor, these stories are affecting every American every day. Every week that we go without passing health care reform, there are over 44,000 more Americans who will lose their health care. There are over 16,000 families who will file bankruptcy because of the high cost of health care that they cannot afford. I am fortunate enough right now to have health care coverage. Approximately 25 years ago, I did not have health care coverage. My husband was employed and he was laid off. I was a nurse working in long-term care, and at that time, they didn't offer health care for nurses for many of our jobs. My husband had one of his first heart attacks at that time. We had no health care coverage. He spent 2 weeks at Ohio State University, and we paid the bill ourselves. Now, I feel fortunate that we were able to do that. We were able to pay that bill. With the rising cost of health care today, with the cost that these treatments would cost today, there would be no way we could pay that bill. We would be one of those families filing bankruptcy, just as those 16,000 families every week must do. This is because of our high cost of health care and our lack of health care coverage. Approximately a month or so ago, I was able to travel to Washington, D.C., and I talked with many of our elected officials, telling them my story, telling them one of the things as a nurse, over 30 years of working in the healthcare field, one of the most distressing things that I've seen is the need for individuals to receive medical care and their inability to do it because of their lack of health care coverage. This is something that is increasing every day. While I was there, I met one of the most wonderful young ladies. She was also there with her mother, and they were talking to their elected officials about health care coverage. She had an illness approximately a year ago that required extensive medical treatment. Her family was lucky enough to have health care coverage, but her parents had been told just recently that they have a cap on their health care coverage, and they were dangerously close to reaching that cap. Because of that, every day this family must make a decision. Do they send their daughter to the doctor if she has a cold, because that's going to increase the cost of their health care? Or are they going to save those dollars for future treatment that she may need? Again, this is a story that every family knows someone who is fighting that same battle right now. I have a grandson who, when he was 15 years old, was diagnosed with a malignant brain tumor. Luckily, again, he was covered under health insurance for his father's health care. He required surgery, and we were very fortunate that that surgery was successful. He had to follow up with MRIs every 3 months. After a year of that, he was able to go to every 6 months. We were getting ready to go to once a year when his MRI showed that the brain tumor is back. He may need additional surgery, but because of his age, he will lose his coverage off of his father's health care. He will not have any coverage. We need an option that allows continued coverage for all Americans, no matter what their age is. As a nurse, as I said, I've worked for 30 years in the healthcare field. Currently, I work for the state of Ohio, and I'm honored to do that. I work in the Medicaid program. One of the very upsetting factors that I see on a more frequent basis are the individuals laid off and lost their health care, whether they changed jobs and lost their health care, they no longer have coverage. They are at the end of their rope. They're coming to Medicaid as a last hope, and unfortunately, a lot of them are not eligible for Medicaid because of the criteria for Medicaid. But these people have nowhere else to turn to. They don't know where to go. These are the